Hello, hello, and welcome everybody. My name is Marcela Mores, and welcome to the Marcela Mores podcast. Uh, I have been a bit busy for the last couple of months working on my research in music and health. It's been busy. I earlier this year I did a little announcement that I was going to start this podcast, um, bringing on board some musicians, people that relate music to science, and just talk about the different aspects of music in our lives, and as well as its influence with science. And so, yeah, I am very happy to be on today live with you guys. I decided this is the best way to do it, and you have to start just going at it. And we have a very special guest today, talking about the best. I find the best perfect way of linking music with science and music and health is uh, with music therapy, and that is the name of our podcast today. We have a very special guest. It's a young music therapist, originally from Vancouver, British Columbia. Her name is Kendall Jones. She loved Nova Scotia, and she came here to study music therapy. Now she's working as a certified music therapist for a year, as she completed her internship uh, in April last year at a long-term care facility in Halifax. She was follow that. She was hired, and she were just started working. As a exciting news. Congrats! And um, so this bachelor of music therapy was conducted at Acadia, which they offered the program, and she completed that in 2019, and also as well as her level 1 of guided imagery in music training. And she's very interested in working with individuals experiencing memory loss, mental health concerns, and physical limitations. And she follows a humanistic and person-centered approach to music therapy. So thank you very much, and let's welcome today our specialist, Kendall Jones. Hi,
Hi, thanks for
Kendall.
having me.
Thank you. So yes, it's going to be a fun a fun time while we walk through the different topics that we want to cover here. First, if you wanted to um, let us know, let me know, and let the audience know about the concept of music therapy and its application in clinical and in overall life.
Sure. Yeah, music therapy is a healthcare profession, and so it's conducted by an accredited music therapist. Music therapists work in all kinds of facilities and with all kinds of populations. So music therapy can look quite different depending on the population, but the premise of music therapy is to use music to help individuals reach certain goals that can transfer to other aspects of their life. So using music to help with spiritual goals or physical goals, cognitive, emotional, and a variety of other domains that are important to somebody's health and well-being.
Great. And can you tell us a little bit about? I think this is a question how we started the conversation, and then I had the idea to get you in for the podcast. Um, what would be the differences between music therapy and music intervention? Is known in clinical settings to that both are used, but they're not precisely the same thing. And I find in the literature that I have been reviewing for my current research that sometimes authors refer to music therapy or music intervention like arbitrary almost. Um,
Right.
can you tell us a little bit about that?
Yeah, I think everyone's aware that music can have a huge impact on health, and that's why music interventions exist, and they should definitely be used by anybody who sees the opportunity. I think probably the main difference between music therapy and music intervention is just that music therapy is conducted by an accredited professional, and so the accreditation process is 4 years of school, a Bachelor of Music Therapy, and that helps us to learn like the different domains of music therapy and the different theoretical frameworks, so that we're equipped to work with all kinds of populations and to treat people in the most appropriate way possible. And then after that, there's a clinical internship, and so those two education experiences give someone the kind of practical and theoretical ability to conduct music therapy in an ethical way. And I would say that music therapy is music therapy because of the education, but also because of the procedures around music therapy. We're bound to a code of ethics. We have to complete certain documentation always in conducting music therapy, so that we can make sure that it's always ethical and that it's always grounded in the most recent research and conducive to bettering somebody's health.
That's yeah, that's amazing. So when people say, because this is this information will actually clarify a little bit of what I'm the research that I'm doing. And basically I'm doing like a what's called in work in the field of evidence based medicine. And the work I'm doing with the prof at Dalhousie at the School of Health Sciences is relating finding the most current up to date evidence of music therapy or music interventions in different clinical settings. We're narrowing down, of course, because it's too broad. But
Right.
one of the things that I have found is that yeah, they some authors mention music therapy, but when I read the paper, it doesn't show that there's a music therapist in like
Right.
involved in the clinical trial that they're doing or in the research in general. So let's say if when they're studying, let's say anxiety or pain, if they put like a headset on the patient and they play some classical music, that is a form of a music intervention, but doesn't necessarily meet the criteria of being music therapy, or it does.
Right. Yeah, I would say it doesn't. I would say if it's not conducted by a music therapist, then it would fall under the category of music intervention, especially whereas the documentation is not would not be, I guess, in line with the what we're bound to, because we're part of an association. Um, in Canada, we're bound to two associations: the Canadian Association for Music Therapists, as well as here in Nova Scotia, we're bound to the Atlantic Association for Music Therapists too. And so the CAMT has ethical guidelines that we have to follow. Um, and and then there's also the American Association for Music Therapy, which is very similar. So, yeah.
That's great. However, it's very important to me in the in the research that we're doing, and I think for overall for everybody that is listening that can take it something away from this, that those are the criteria to be for it to be music therapy. It needs to be conducted by like a certified music therapist. However, that doesn't take away the value of using music
Oh,
interventions at different settings, right? Because also I believe the you will provide a number of protocols or guidelines and work with other scientists that would promote the use of music at a
mhm.
different way. So even though if it's not being practiced by music therapists, if there's some form of effective music intervention, that could be very positive as well.
Yeah, I think it can be very therapeutic, and even if it's not considered music therapy, I think it can be therapeutic music interventions. Yeah, certainly.
Excellent. In regards, I was asking you earlier in regards like the guidelines or protocols that you have to work on a day on your day to day uh, job. Um, can you actually? Is it possible that you can describe us a little bit of how your experience? What kind of populations are you working with? What kind of patients are you working with? How do you find that personal and as a professional? Um, how do you feel? How do you find the challenges of the work, and how could you describe us what is the day to day experience, and if you can mention a little bit of the uh, maybe recreate briefly like a protocol or guideline of how you conduct a music therapy session.
Sure. My day to day is, well, I work in long-term care, so it's full time. I work from, morning till late afternoon every day. And usually I do like 3 group sessions per day and a few, or 2 or 3, depending on the day, and a few individual sessions as well. Um, and those are on different units. And uh, I usually establish a few different goals depending on an assessment that I perform for the clients. So in long-term care, a lot of the goals are oriented around uh, serving people best who have memory loss and disorientation. So usually I set my goals on a day-to-day basis. So I would walk into a room, talk to a few people, talk to some of the nurses and the other healthcare professionals, and just kind of figure out how I can best serve these people today at this time, depending on what time of day it is or what they need, and set the goals in that moment. So if I were to assess that the group is mostly needing to meet spiritual goals, then I would conduct a spiritual session. Or if it's more of a cognitive based group, then I would do that. And so that's kind of more impromptu, just so I can always make sure that my work is authentic in meeting the client where they're at in that very moment. For example, like in the late afternoon, it's really common in long-term care for individuals to start this process called sundowning, which is the process of looking for home and becoming very agitated and more confused than in other points of the day. It's sort of like a biological response that we have to the sun going down, and in people with memory loss, that's interpreted usually in a more confusing way. So for my afternoon sessions, I might kind of target the group goals more toward helping people orient to their environment, providing comforting music that might remind them of home, and just like creating a safe environment and experience for them. And my individual sessions are much more based on referrals and assessments. So um, most of my caseload, my individual caseload, is brought to me through a referral process from nurses or the dietitian or physiotherapy or occupational therapy. And once I receive a referral, I'll perform an assessment on an individual. And the assessment is like a standardized tool that we have as music therapists to help us determine which goals and objectives are going to be most beneficial for that person. And then that assessment is uploaded onto their file so that it can be accessed by anybody who's involved in their healthcare. Because we definitely, like in long-term care, it's definitely an interdisciplinary approach. Like I want to know what the physiotherapist is doing just as much as they want to know what I'm doing, because it's all part of somebody's health experience. And so I upload that there, and then uh, after each session, I will chart on the session and describe as objectively as possible what happened. And that's just a way to keep myself accountable, as well as for other people to understand what's going on. And then I can reassess somebody and make sure that their goals and objectives are still appropriate for them later on. That's just a little snapshot of my day to day, but there's other things behind the scenes too.
That's amazing. No, you mentioned about the multidisciplinary approach, and that is extremely important, and more taken into consideration with groups of professional or healthcare professionals, because from music therapy is like a fairly young discipline,
Yeah.
and is already being like gratefully and being accepted into more and more into the healthcare system. And no wonder music has been with us since the beginning of civilization, right?
Right.
And there's a lot of lots of anecdotes of the ancient like philosophers. I believe there was I was reading a little bit that I believe it was like Da Vinci or Da Vinci that he used to uh, ap- he acknowledged the power of music of music, as he was kind of like doing some work. I'm not sure if it's Da Vinci or Michelangelo. So yeah, Da Vinci, I believe. So is there any anecdote like that, like either like a mythological anecdote that you may be aware of, something that you want to share, that where music was being used very back in time?
Hmm. That's a good question. I don't know. Yeah, I think there's a lot of evidence about music affecting us on kind of a more like biological level and a rhythmic level, like just in our. I mean, I don't know if this is a historical example so much as it is kind of a stood the test of time example. But yeah, music's been in our societies forever, um, and we were designed to interpret music as human beings. We function. I mean, of course, you're a biologist, but we function in these rhythms and cycles and like circadian rhythms and all of that, and we interpret music on such a biological level, especially rhythm. Rhythm, something that is understood to human beings since before they're born. Um, and so I think that's interesting that it's built into us. And so I think finding a way to kind of draw it out and use it as a tool for healing it just makes sense. It's already part of us. So mhm.
Amazing. And when you're in the setting working with that, you mentioned you work one on one and also with groups of people,
Mm,
right? Uh,
yeah.
it's it, is it through music creation driven, singing, using musical instruments? Can you describe that a little bit? I find it's very what style of instruments would you use?
Yeah, I do a lot of session planning in my day to day, and my session plans are just so that I can make sure that people are having a chance to express themselves in all domains of health. And so some of my sessions, I'll always try to do like one rhythmic session per month per group of people, so that everyone has at least one experience to express themselves creatively on a rhythmic instrument. I call it rhythm band, but different music therapists call it different things. Um, and so I'll bring tambourines, shakers, a few big drums, depending on who wants to be. I always say, who wants to be the heartbeat of the group today? um,
How do
and
they engage?
yeah, I find rhythm band, creates a very high level of engagement because of just like the sensory experience of being in a room full of instruments and full of rhythm. But I find almost everyone in that kind of group will engage and will smile and will play the instrument. And I often notice that people become, well, we call it like rhythmic entrainment, where the beat is internalized and becomes very natural for someone to produce. And so that's neat to see. I always encourage people to improvise in those groups too, and I think that can be a really validating experience for somebody to have a moment to just express themselves and be supported by a group of their peers. So I do those groups. I do like cognitive based groups, like songwriting circle. I do with people who are on long-term care, maybe more so due to physical limitations or very mild cognitive delay, but but not so much that they're not able to kind of create and engage on that really cognitive level. So I find a lot of people who are experiencing less memory loss than the majority find themselves isolated because um, they don't maybe have as many people to talk to or to engage with on a really intellectual level. So I always try to have those groups as to be quite targeted toward people who are maybe looking for more of an outlet to create and to brainstorm and just yeah engaged in those discussions. Um, what else? So many things. Spiritual groups are really important to
when you
people's
when you mention
well-being.
when you mention spiritual groups, do you incorporate like elements of mindfulness and meditation into it?
Yeah, sometimes we do that. Yeah, I was conducting a group. It was less spiritual oriented and more sort of mindfulness oriented, I suppose. It was a group for people who were living on the secured dementia unit of the building, who were experiencing sundowning behaviors. Um, so just bringing those people into a quiet room. I did some like I had some candles lit and focusing on breathing and imagery as a way to kind of prime themselves to have a more restful and peaceful evening and maybe not escalate into a sundowning behavior. And yeah, and so for the spiritual groups, a lot of people in Nova Scotia who are of that demographic in their 80s to 90s and above are of a Christian or Catholic background. So I try to support them with things that are, scripture and readings and hymns that are important to them throughout their lives.
Yeah, that's something that is very important. That I also have read in some of the randomized controlled clinical trials that I'm reading how they're incorporating into their observations that when you're working with patients, you need to account on their own culture, right? Like I'm myself, I'm originally, as I mentioned to you earlier, I think I'm originally from Cuba. Let's say if there was a Cuban music therapist down there, they may find like a bolero
Mhm.
song or bolero rhythm very positive and very because it's very so with a very positive impact, because it's very ingrained with the culture. But
Right.
up here, either like a religious component of if they're like, for example, of Scottish or Irish background or Arab background, maybe a music that will cater their culture will be more effective.
Totally. Yeah. Yeah, cultural considerations are super, super important for sure.
There's also a controversy that I've been that I read about that maybe you can elaborate a little bit more about. That is that that is important, but also it have to be careful and done at a one-to-one basis, I believe, because some people may have let's say bad memories or traumas attached to a specific episode back in their lives, in their past, that was attached to this music, even maybe if it was like relevant to their culture. So
Totally.
have you come across something like that?
Yeah, yeah, I think that's why I find it so important just to like really build that rapport, maybe even before you ever use any music therapy intervention with somebody to, collect as much information as you can that's relevant to their background and what they've been through. Um, because it all comes into therapy, like it's all relevant and makes that person who they are. And so I always try to take that time to understand um, people before initiating music therapy interventions, just because you're absolutely right, sometimes there are different songs or discussion topics that can be really triggering for people depending on what they've been through. And sometimes sometimes we accidentally we don't know and we use a song that is triggering for somebody. And I think in those cases, it's just about documenting that and knowing it for next time, um, and just always trying to conduct in the most ethical way. Yeah.
Great. What is your, or maybe more than one, your main instrument?
Uh, my main instrument in school was voice, but in music therapy, I almost always play guitar and sing because it's just more accessible, easy to take around, and
Yeah.
I always find myself in strange positions when doing music therapy sessions, depending on where the resident is, if they're in their bed or in a chair or at the dining room or something. It's just easier to have a portable instrument. So usually I find myself on the guitar.
Yeah. And so do you also do a small performance for the patients that you work as part of the session or as an introduction? How would you play into that? Because I think it's regardless. That's why music is so important. We need music. We need to see the performer. Are you sometimes well allowed by the entire protocol? Are you a little performer working with your patients sometimes? A little block of time?
Yeah, sometimes it just helps to kind of set the mood to do a little live music before we get into our session. But there's always live music throughout, and like I always encourage the residents to engage as much as they want with my playing and singing. But sometimes it just so happens that people are more in a receptive headspace, that they just want to kind of listen and allow the music to be its own therapy. So
Mhm.
yeah.
But you do also use the singing as part of your therapy.
Yeah.
And I've been reading a little bit and obviously discovering through all my readings like the style of Orff singing
Okay.
that I find very there's plenty of YouTube videos out there working with kids and seeing how that enhances cognition and how is that something that you can that you that technique, the Orff singing technique that you may use uh, sometimes, or can you tell us something about it? More.
I'll be honest with you, I don't know much about Orff. I remember sort of learning about that in school, but I don't work with a younger population at this time. I usually just work with older adults. Um, some theoretical frameworks that I've drawn from. I'm not a neurologic music therapist. You have to go through a certain amount of training to do that. But I do draw some tenets of neurologic music therapy. So helping people who've maybe had a stroke or have some form of aphasia to use music to increase their speech production and their breath control, as well as right now I'm using music with somebody to help strengthen their vocal cords and therefore their swallowing mechanism because they're having trouble swallowing food, and
Oh
so
wow.
using singing, therapeutic singing to help just strengthen those physiological systems that are all connected. So yeah, but yeah, that's all I know about therapeutic singing. I don't know anything really about Orff singing, so feel free to.
No, but that's great because you can adapt to what you use and you actually have the ability to work with different pockets of of the music therapy and adapt it to your day-to-day sessions. That's pretty remarkable. Um, Another thing that I wanted to add and I wanted to ask you, I'm curious to see if you have had the experience yet. There's certain patients that given their mental condition, um, they say that psychotherapy may not work because they're not able to speak. There's some sort of part of the brain is being affected. But so these other alternatives to dealing and helping patients won't really work because they can't engage verbally, and that's where music therapy takes on like a full percent, right? 100%. Have you had experiences like that? And can you?
Yeah, yeah. I mean, I think I see that a lot just in people with end stage Alzheimer's and dementia, where um, everybody experiencing Alzheimer's or dementia reaches a point where verbal communication isn't possible anymore, and that's really hard. And it's really hard for families to feel connected to their loved one when that's the case, and it's really hard for them because for the individual experiencing the dementia because they still have needs that need to be met, and now they don't have as much of a way to communicate those needs. So I've certainly seen people who aren't able to speak but are still able to sing and engage with music, or even just tapping their foot to music when maybe that's the only sign that they're still in there, that's visible to someone who knows them. So that's touching. I really enjoy that part of my job, just being able to connect with the human part of somebody, even when parts of them aren't really accessible to us anymore.
That's yeah, no, that's really amazing. And I was just thinking, have you had like patients like with with that with that condition that you have been able to follow up with them several times, have multiple sessions, and sort of describe to your experience the progress in their cognition or they're able to their ability to communicate a bit more. Have you witnessed that? Have you experienced that to 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 an extent?
Uh, Not really with dementia or Alzheimer's. It's always degenerative. So I think
Mhm.
we don't really take like a progress or a what's the word I'm looking for? Um, yeah, like a progress approach so much as like a process approach, I guess. So I think what my goals usually around people who are at end stage dementia is just to improve their quality of life and to enhance their ability to communicate within the limitations of their disease. So I think what they're able to do is always in there. I think it's just maybe finding a way to use music to draw it out more so that they can still connect with their environment and communicate their needs, and connect with their family and loved ones and that sort of thing. And yeah, and occasionally like we do have people coming in with like stroke or other neurologic conditions, and I think music therapists working with people in that sort of way, there would be more progress seen. Like you might actually be helping to rehabilitate someone more than just kind of maintain their quality of life. And I know the music therapist who I'm just covering a maternity leave right now, and so the permanent music therapist at my facility, she has a background in neurologic music therapy, so she's more familiar with kind of I think um, the rehabilitation approach
Wow,
to that.
that's a good
Mm.
challenge for you then.
Yeah, I'd like to get my training in that because I think that would be really helpful.
Right. Would your training in imagery that will be getting like there'll be some steps to get into the neurological aspect of music therapy?
Uh, they're separate disciplines, so
Mhm.
um, I'd like to continue my guided imagery and music therapy training, but it's not generally deemed appropriate for use in like a long-term care population. It's very like psychodynamic
Mhm.
rooted, and so I'd like to have that training, for if I were to ever work with more of a mental health population. But I think just whereas I do work in long term care, I can see more of a practical application for neurologic music therapy training now. So hopefully I'll be able to complete that within the next few years.
Absolutely, no, that's great. When it comes to the caregivers, because ultimately after some of the patients after they're done with your session, is there some tips that you recommend to their direct caregivers, some sort of like guidelines to say, yeah, you should instead of instead of like the well, I'm not sure if it's a good analogy or not, but instead of prescribing a pill, you prescribe maybe in the afternoon or in the evening, do this particular like music exercise or sort of music engagement, or ask them to see if they remember. Is that part of um, your work too, to recommend their
Yeah.
caregivers?
Yeah, definitely. I think a lot of people just in my facility, but I'm sure in others too, like I really do recognize the benefits of music therapy, and I'm really grateful for that. And they're interested in learning how they can bring music into care. And so, like I'll see that in people like bringing music into the shower rooms, because that's the time when individuals with memory loss may become especially agitated. Or we just set up like Alexa speakers in our facilities so that we can always have comforting music playing and to orient people into common areas with music. And so yeah, there's definitely an interdisciplinary approach in that way, just like always incorporating music into care, even when the music therapist isn't available. And I think um, yeah, I always encourage the people on my team to just consult in me whenever they want any advice on how to make someone's care experience a little bit more comforting with music.
Would that be sort of like I've read in the literature that they refer to as passive music therapy? Would that be an example of that? Uh, that you the music therapist, you recommend a few, a few of the proven or evidence based uh, uh, activities that that you and the field recognizes as effective,
Yeah.
sort of is. But then if the caregiver applies that to the patient, would that be sort of passive music therapy considered?
Hmm. Yeah, maybe I would like it's definitely a passive experience. So
Mhm.
yeah, passive music intervention or something of the sorts. But yeah, yeah, I would say so.
Because as I said in the literature, I find there's a little bit of confusion in the use of terms of music therapy and music intervention. So I wanted to well, it's important to clarify that, just
Mhm.
to understand the concept, but also to respect the discipline, right? uh,
Yeah.
I was just thinking like a social worker is extremely important in healthcare system, but it's not like a clinical psychologist, even though it applies psychology to their work. But that's the analogy that I found, kind of like if you were to call a social worker a psychologist, they're two separate things, even though there's sort of crossover.
Yeah.
um, I think uh, I think that's important to clarify.
Right. Yeah. Okay. I see what you're saying, and I think part of the important part of music therapy too is that a music therapist is present for the whole experience, even if it is a receptive experience, um, because we're trained in how to respond to like certain elicited emotions or behaviors as they're receiving a music experience. And so yeah, I would say that we're just giving tools to the team to how to use music in a therapeutic way in care.
Yeah, that's great. And hopefully, as the time goes on, I mean, that there's right now there's probably a high need on on music therapy techniques and applications with the whole healthcare system and the whole like planning for reducing stress and anxiety, given to the all the lockdowns that have been happening due to the pandemic, and
Mhm.
potential raise in and mental health uh, issues. Um, I'm sure that's I mean that's this is something that is being implemented, but yeah, I'm sure that's going to be something that will keep you guys, music therapists, really busy. Um,
Yeah.
I believe this is extremely important. Important the research part of that you also provide tools to the clinicians to maybe implement this, because right now, as far as more if I'm concerned, there's not enough music therapists to cover the need. So
Hmm. Yeah, that's true. Yeah. So
very
I agree. I think it's really important that we give access to all the resources we have, so that everyone can help people with the use of music, even when there's not a music therapist around. But hopefully, hopefully facilities will be able to hire more music therapists as the profession gets more established and as roles get created and whatnot. But yeah, it is a little bit of a struggle right now for sure.
Hmm. I think I, the word should lead into music therapists and researchers to promote uh, on the based on the all positive results to promote that more, because it's one of the things that is music therapy and music interventions can be very effective, is that it could be a lot cheaper. Is if you have
Mhm.
like a music intervention that will help consistently to reduce the level of anxiety or cognition, you may not need to prescribe so many drugs that may cause like as many side effects.
Totally. Yeah.
That's
Yeah.
very
Absolutely.
important. The very last thing, if you mind, do we have a couple of more minutes?
Yeah.
I wanted to ask you a little bit about sound therapy, whether if it's considered like is it a tool that is it considered a different discipline, and it's also a tool that you use right now. If you go on YouTube and you type in sound therapy, there's going to be a lot of playlists that will come that talk about the brain waves, and there's playlists done for concentration and for sleeping and for um, happy mood. Is that something that you implement? Are you kind of take into your day-to-day work, or what is your thought on that?
I'm interested in it, and I don't really use that much in my day-to-day work. And to be quite honest, I don't know if that's considered music therapy. I certainly see the merit in it. I think, there's such a huge correlation between brain waves and music waves, and I think that can be healing for people on an emotional and physical level. But whether or not it fits into the discipline of music therapy, I don't know.
Mhm.
Yeah. Yeah, I
Maybe.
mean, sound is something I think about a lot in my work, like, but more so just the difference between, like, um, purposeful therapeutic sound or the kind of noisy environment that sometimes exists in healthcare settings, and just like always trying to make sure that the sound is comforting and not distressing for people. And we had our permanent music therapist, the one I mentioned previously. She conducted some research about the difference between sound and noise, um, and but yeah, I don't know much about sound healing. So
Interesting. Would that be something that, if in your future steps of your career, getting more into the neurological side, would that be potentially more covered there?
yeah, I think that could, it's all about how music affects the brain. So I'm certain that would be a component to that.
I find that so fascinating. And
Mhm.
yeah, like sometimes right now here at home, because I'm doing a lot of my work from home now, like a lot of the studying and upgrading, and I find that either like playing like a relaxation music playlist on YouTube, it kind of helps to bring like the tone down to just maybe feel less like less anxious. I'll say.
Mhm. Yeah, absolutely.
Very good. Is there? Well, thank you very much. Is there anything else that you would like to share with us today, Kendall?
No, not really. I mean, I think I'm just giving a little snapshot of what music therapy is based on my experience, and my experience is primarily in long-term care and working with people with memory loss. But I think, if you're interested, there's the approach that a music therapist who works with a psychiatric population would be very, very different, or with children, or oh gosh, people experiencing pain or neurologic rehabilitation. So yeah, there's all kinds of variants, I guess, in the field. So just yeah, I think if you have the opportunity to talk to any of those professionals, they probably offer some different insights too.
I'm sure in the future you can refer me to some, and I'd love to down the road potentially have you again and any of your colleagues to explain more about a little bit about that, because I hope to in the podcast to continue to talk more about the music and in our lives and how it influences in our health and our well-being and science in general. So I look forward to that. So, well, thank you very much for being with me today. Thank you so much for your time. And again, this is Kendall Jones, a music therapist. Thank you for joining me today. And I wish you all well and keep promoting the value of this discipline, because I truly believe is very effective and very important. And I'm just very excited that this is happening.
Thank you, Marcel. Thanks for having me.
Thank you. Okay. Have a have a good one. I hope to see you soon.
You too.
Alrighty. All right. Thank you very much for watching us today. It's been this is my very first this is my very first episode having a guest, and I look forward to having um, more musicians and music therapists, scientists involved in the program, and I am yeah, I'm very excited about this. Thank you so very much for being here today with us. And if you like, please share some comments and please subscribe to my YouTube channel. Again, this is one of my very first podcasts. I look forward to continue to do uh, more live streams and bringing more fun and more knowledge into this. Um Tell us what you think. Leave your comments, and I'll be happy to answer them. And as well as feel free to ask some questions to Kendall. I'm sure she'll be happy to address them. And thank you so much again, Kendall, for promoting health and well-being through music therapy. Thank you.